What's going on, everyone? It's Alex here from Alex Physio. Today we're going to be going over 4 tests that you can do to determine whether the pain that you're having is coming from your SI joint. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia, and today we're going to be going over 4 tests that you can do to determine if the source of your pain is coming from your SI joint. Let's get right into it. The first test is palpation around your SI region. So if you take the web space of your hands and you put it right on the bony parts of your hips and you move your thumbs into the center, you're at the lower back L4, L5 area generally. So if you just take a few finger widths from that area, you can feel along that SI joint region. We say from S2 to S4. If that's tender, so just to the outside of the middle of your sacrum, if that's tender, if that reproduces pain, that's one finding that may indicate that the pain is coming from your SI joint region. So direct palpation around S2 to S4 region. Test number 2 is just a single leg test. So what you're going to do here is you're going to stand on your left leg and you're just going to try to bring your knee up to 90 degrees. And you're going to see if this reproduces any of your pain. This is just a pass-fail test, so either you can maintain this position or not. So you're going to do it on both sides, and you're going to see, does that reproduce the SI joint or your pain symptoms? And if it does, again, gives us more of an indication that the pain you're having is likely coming from your SI joint. Test number 3, we're going to do the 4P test. So this is a posterior pelvic provocation pain test. So what this is going to look like is you're going to lie on your back, and obviously this would be easier if you were at a physiotherapist's office to do this for you, but you're going to basically bring your knee up, you're going to bring your knee inwards, you're going to rotate your hip inwards, and from here you're applying a force. Again, it's harder for you to do it on your own, but you're applying a force downwards through your femur, your thigh bone, and you're trying to see, does that pressure down reproduce any of that pain in your SI joint or the back of your pelvis region. So you're applying a pressure down while keeping your hip in this flexion, adduction, internally rotated position. See if that reproduces the pain. Test 4, you're going to do an active straight leg raise test with compression. So basically, I want you to think about having the other knee bent and the other one straight. You're going to try to lift your leg up. If this reproduces your pain or heaviness in your leg, or feels heavy on one side relative to the other, so if it feels painful or heavy, it's not necessarily a positive test. But if you apply compression, so if you take your hands and you try to compress your pelvis area, and then do the same thing, if that feels easier or less pain and the leg feels less heavier, then that's a positive test. If all 4 of these tests are positive, then there's a much higher indicator that the pain is coming from your SI joint region. Last test to confirm that the pain is coming from your SI joint is to have an SI joint block. So an injection done in that area to see if that removes or eliminates the pain. And if it does, then that's a more confident way of knowing if the pain is going from your SI joint. But if you have all these other tests, then that increases the suspicion of the symptoms coming from your SI joint. A couple other subjective things to be mindful of. Generally, individuals find that asymmetrically loaded movements, so things like lunges, things like going down the stairs in particular because you're standing on one leg for a period of time, generally that tends to provoke the symptoms. People find that when they're walking, it tends to feel better because you're not in a position where you're standing on one leg for a prolonged period of time. But if you stop and stand, like if you're shopping, then that tends to reproduce or become a little bit more aggravating. So standing in one place, going downstairs, getting in and out of a car, lunges, asymmetrically loaded movements, those can also increase the suspicion that the symptoms are coming from the SI joint. Let me know what you thought about this video. Do you have SI joint pain or pain coming from your SI joint? How has your recovery and your treatment been? What are some things that have worked and haven't? Have you ever got an SI joint block or injection done to try to help alleviate some of the symptoms? let me know down in the comments below. Obviously, these tests are much easier done with a physiotherapist, so please see one if you feel like you are struggling with SI joint pain or any other pain, as this isn't medical advice, but just generally gives you an idea of what to expect and to have a little bit more knowledge and education on how we look to diagnose SI joint related pathology and pain. Hopefully you found this video informative. If you did find value, please consider checking out some of my other videos. I have over 500 videos on various physio, exercise, and medical related topics. And if you still find value, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.